The warning: every 66 seconds, another senior in this country is told they have dementia. By the time this video ends, 20 more families will have heard those words, and for some of them, the cause was never their age. It was a bottle sitting on the bathroom shelf that they were promised was safe. I'm Dr. William. After 15 years of practice, I've watched this exact picture play out more times than I can count. Someone who is sharp their whole life starts losing the thread. Names, appointments, the drive home they've made 1,000 times, and everyone around them calls it getting old. It wasn't. It was a medication. One almost nobody thinks to question because a doctor prescribed it and a pharmacy filled it. Here is what the newer research keeps showing. One ordinary everyday class of drug can pull your memory and your learning down hard inside a single year. And most people taking it have no idea it is happening. Today I am walking you through the 9 medications most closely tied to rapid memory loss. Count it down from the ones that get quietly overlooked to the one I consider the most destructive of all. Watch for number 3. It is handed to millions of seniors for something that sounds completely harmless, and it may be shrinking the memory centers of your brain right now without a single warning sign. Before we start, tell me in the comments how old you are and which medications you take every day. I read medication number 9 them, and the age of this audience shapes what I cover next. Let's start at number 9. And don't let the low spot on the list fool you because this one is sitting in almost every medicine cabinet in America. Number 9 is diphenhydramine. You know it by its drugstore name, Benadryl. It is the little pink pill people reach for to fall asleep, to calm an allergy, or to take the edge off a cold. It costs a few dollars. It sits on an open shelf, and most people assume that because nobody needs a prescription for it, it must be gentle. Inside your brain, it is doing something very different. Benadryl belongs to a group of drugs called anticholinergics. That is a long word for a simple idea. They block a brain chemical called acetylcholine. Acetylcholine is the messenger your brain uses to lay down a new memory and to stay alert through the day. As we age, the brain makes less of it and leans harder on every bit it has left. So, a drug that blocks it lands far heavier on a 70-year-old brain than a 30-year-old one. The part that takes the hit is the hippocampus, the small seahorse-shaped structure where new memories are formed before they get filed away. In my practice, I've watched patients take a nightly antihistamine for years and slowly lose their edge, never once connecting the fog to the pink pill by the bed. The research connects it plainly. A 2023 paper in the Journal of Geriatric Cognitive Health followed older adults who used anticholinergic drugs regularly and found a 54% higher risk of developing dementia compared with people who stayed off them. More than half again, the normal risk from something most of us treat like candy. Here's what to do. Read the label on anything you take to sleep, and anything marked PM, nighttime, or allergy relief, because those are very often just Benadryl wearing a different medication number 8 name. If you take it for allergies, there are newer antihistamines like Laoretine, sold as Claritin, that do not cross into the brain the way Benadryl does and are far safer for the long haul. Never stop a medication on your own. Bring it to your doctor. But stop assuming that over-the-counter means safe for your memory. That is number 9. Number 8 is one your stomach loves and your brain quietly pays for. Number 8 is the proton pump inhibitors. The big names are omeprazole, so does Priloc, and esomeprazole, so does Nexium. These shut down acid production in the stomach, and they get handed out for heartburn reflux and that burning feeling after meals. People stay on them for years, sometimes decades, because the moment they stop, the symptoms come roaring back. So, it feels like the drug is the only thing holding the line. Here is the part almost nobody hears at the pharmacy counter. Your stomach needs acid to pull certain nutrients out of your food, and chief among them is vitamin B12, which protects the wiring of your nerves and your brain. Turn the acid down far enough, long enough, and your B12 quietly drops. So do magnesium and calcium, 2 minerals your brain cells depend on to fire and signal cleanly. Starve the neurons of those and you get misfires, confusion, and memory slips that look exactly like early Alzheimer's, when the real cause is a nutrient your medication has been blocking all along. In 2016, a large study in JAMA Neurology examined more than 73,000 people aged 75 and older. Regular PPI users had a 44% higher risk of dementia than people who did not take them. And the trouble runs deeper than nutrients because PPAs have also been shown to raise levels of amyloid beta in the brain, the sticky protein that builds up in Alzheimer's disease. So medication number 7 here is the move. If you take a PPI every single day, that is the conversation to have with your doctor. Many people can taper down onto a gentler class called H2 blockers like Photodine, sold as Pepsid, which is far less likely to affect your thinking. Chewing the glycerinated licorice, a natural compound that coats and calms the stomach lining, can ease symptoms with no cost to the brain at all. The goal is the lowest dose for the shortest time, not a pill you take forever out of habit. Number 7 is prescribed for a problem most people would rather not talk about. Number 7 is the bladder drugs, and the one to know by name is oxybutynin, sold as Detropan. It is given to seniors who deal with a sudden urgent need to get to the bathroom. The kind of overactive bladder that can reshape a whole day. The relief is real, and the embarrassment it spares people is real too. But oxybutynin works by blocking acetylcholine, the same memory chemical Benadryl blocks, and this one slips across into the brain very easily and parks itself right where memories are made. That makes it one of the more dangerous ones on this list for an older adult, especially when taken months after month, year after year. In 2019, the British Medical Journal published a study of people over 65 who took strong anticholinergic drugs like oxybutynin for more than a year. Their risk of dementia was 49% higher, close to 1 in 2. And here is what troubles me most. Almost none of them were warned. They were told a pill would calm the bladder. Nobody mentioned it might be dimming the mind at the same time. The fog gets blamed on medication number 6 age. People describe forgetting appointments, losing their keys 10 times a day, dropping the thread of a simple conversation, and everyone around them nods and says, "Well, you're getting older." It is rarely traced back to the prescription until real ground has already been lost. If you take oxybutynin and you have noticed your memory slipping, take that seriously because you do not have to choose between your bladder and your brain. Newer drugs like Miragron, sold as Myrbetriq, work through a completely different pathway and do not block acetylcholine at all. For most older adults, they provide the same control with far less risk to thinking. Bring it up at your next visit. Number 6 might be the most surprising one here because it is one of the most prescribed drugs on earth. Number 6 is statins. Simvatin and atorvastatin, sold as Zocore and Lipor, are among the most prescribed medicines in the world, especially after age 60, and they do an important job lowering cholesterol and reducing the risk of heart attacks and strokes. Statins belong in a lot of people's lives, and this is not a case against them. What follows is the half of the story that usually gets left out. Cholesterol does far more than affect your heart. Your brain is close to 60% fat, and it uses cholesterol to build the myelin sheath, the insulation wrapped around every nerve, so signals travel fast and clean. Lower cholesterol hard enough with a strong enough statin, and you can leave the brain short of a raw material it actually needs. The statins that cause the most trouble are the ones that cross easily into brain tissue. In 2023, a study published in Frontiers in Aging Neuroscience found that adults over 70 who had been on statins for more than 3 years had a 26% higher rate of mild cognitive impairment, and the higher the dose, the medication number 5, steeper the decline. Some patients described frightening blanks, a familiar name gone, a conversation they had just finished erased, a route they had driven for 20 years suddenly unfamiliar. The important thing to understand is that not every statin affects the brain the same way. Pravastatin and Ruatin do not cross into brain tissue as readily and are generally considered safer choices when it comes to preserving cognitive function. So, if you've been on a statin for years and you are noticing fog, forgetfulness, or confusion creeping in, that is a real conversation to have with your doctor about a lower dose or a switch. It is not a reason to quietly stop a medication that may be protecting your heart. Get the plan right with professional guidance, never on your own. Quick pause. If this is helping connect the dots for you, take 1 second and tap that like button. It genuinely helps this information reach more seniors who need to hear it. And while you are down there, tell me how many prescriptions you are taking right now. I read every comment. Alright, back to the countdown. Number 5. Number 5 is the benzodiazepines. Lorazepam, sold as Ativan. Diazepam, sold as Valium. Alprazolam, sold as Xanax. These are among the most commonly prescribed drugs in America for anxiety and sleep problems. They work by boosting GABA, the brain's natural calming signal that turns down an overactive nervous system. At first, they can feel like a rescue. The panic eases. The racing thoughts slow down. Sleep finally comes. But over time, the picture begins to change. A 2022 study published in the British Medical Journal followed more than 8,000 seniors for 6 years and found that those who used benzodiazepines for longer than 3 months had medication number 4, a 51% higher risk of developing Alzheimer's disease. The longer-acting medications such as diazepam appeared to be even more problematic because they remain in the body longer and accumulate in fatty tissues, including the brain. What these medications do is create a slow chemical sedation of the entire brain. Learning becomes slower. Mental flexibility decreases. Many people describe a sense of emotional flatness as if they are moving through a fog and no longer feel entirely like themselves. The cruelest part is the exit. If a benzodiazepine is stopped abruptly, anxiety and insomnia often return with even greater intensity, accompanied by agitation that can become genuinely dangerous. That makes the medication feel indispensable at precisely the moment it may be causing the greatest harm. So here is the rule, and it matters. If you've been taking a benzodiazepine for more than a few weeks, do not stop suddenly because doing so can be life-threatening. Work closely with your doctor to taper the medication gradually over weeks or even months. There are gentler alternatives. Buspirone, for example, can help with anxiety without causing sedation or mental clouding. There are also specialized forms of talk therapy designed for insomnia and anxiety that can restore calm without the cognitive cost. Now let's move to number 4. Number 4 is a single medication prescribed for 3 different problems, and it carries one of the heaviest hidden burdens on this list. Number 4, medication number 3 is amitriptyline, sold as Elvil. It is an older antidepressant that is still widely prescribed today for nerve pain, sleep difficulties, and even migraine prevention. That versatility is exactly why it became so widespread. It looks like a medication that can do everything, but beneath the surface, it is one of the most powerful anticholinergic drugs still in common use. That means it strongly blocks acetylcholine, the very chemical your neurons rely on to communicate with one another and to store new memories. It blocks acetylcholine so aggressively that with long-term use, memory problems stop being a rare side effect and begin to resemble an expected outcome. In 2015, a large study published in JAMA Internal Medicine followed more than 3,400 adults aged 65 and older. Those with the highest cumulative exposure to anticholinergic drugs, such as amitriptyline over a 10-year period, had a 54% greater risk of developing dementia, and almost none of them were ever told that the medication could do that. They were given it for sleep or for pain, then gradually noticed words disappearing, memory becoming thinner, concentration weakening, and they simply assumed it was part of getting older. It does not even require a high dose. A small nightly dose taken for years can quietly erode cognitive function without any obvious warning signs until the loss becomes significant. If you or someone you love takes amitriptyline, that is a medication number 2 conversation worth having soon. For nerve pain, options such as duloxetine or gabapentin may provide similar relief without the same anticholinergic burden. For sleep, melatonin or very low dose of dosipin, which is considerably gentler on this chemical pathway, may serve as alternatives. And for mood disorders, newer antidepressants such as sertraline or escitalopram are generally considered much safer for the long-term health of the brain. Number 3 is the one I told you to watch for because it is prescribed to millions of people for something that sounds completely harmless. Number 3 is paroxetine, sold as Pexil. It is one of the most widely prescribed members of a family of antidepressants known as SSR, is used for both depression and anxiety. On the surface, it appears to be a modern, gentle option, far kinder than many older psychiatric medications. But here is the detail that is rarely discussed. Paroxetine is the one SSRI with strong anticholinergic activity. That single characteristic sets it apart from related medications such as sertraline and escitalopram because it affects the same acetylcholine system that every other medication on this list has been disrupting. In 2021, a large review published in Frontiers in Psychiatry examined older adults taking different SSRIs and found that paroxetine users demonstrated measurable declines in short-term memory, word recall, and attention within the first 12 months. Seniors taking paroxetine were 30% more likely to show early signs of cognitive impairment than those using other antidepressants. There was a painful irony in that finding. The medication is prescribed to help stabilize the mind, yet over time it may erode the very clarity it was intended to protect. The solution here is straightforward. In older adults, paroxetine is generally a medication worth avoiding when alternatives are available. The American Geriatric Society placed it on the Beers list, a medication number 1 formal catalog of medications considered potentially inappropriate for seniors, and paroxetine appears there for precisely these reasons. If you take it, speak with your doctor about the possibility of switching to a safer SSRI such as sertraline or escitalopram, which are gentler and do not carry the same cognitive concerns. Supporting healthy levels of B vitamins, especially B12 and B6, may also help support mood alongside these changes. Number 2 is prescribed so quietly that many people taking it do not even realize what type of medication it is. Number 2 is antipsychotic medication. And this one concerns me deeply because many individuals taking these drugs never knowingly agreed to take an antipsychotic. The names include quidapine, sold as Seroquel, risperidone, sold as Respol, and olanzapine, sold as Zypria. These medications were originally developed and approved for serious psychiatric conditions such as schizophrenia and bipolar disorder. Today, however, they are often prescribed off-label to older adults for sleep problems, mild restlessness, or agitation associated with dementia itself. Powerful medications designed for severe psychiatric illness are now frequently used in homes and nursing facilities for seniors who are simply confused, restless, or difficult.